Okay, welcome to the Town Meeting Talk Show. This is the 14th of April. It's a Tuesday. Not that it's especially easy to tell what day it is in these pandemic times. Our show here is brought to you, as always, by Cordova Wireless Communications, your local cell phone provider. And they provide your local, he tried to say your local talk show. He didn't say it very well, but he tried. Big thanks to them. They and CTC, big supporters, as we've been saying, of local radio, which is how we do what we do. And a number of things to go over today. First, the document of focus will be the latest news release from the city, which, as always, you can see by going to their website, cityofcordova.net. If you prefer to read these things rather than hear them, that's entirely up to you. And that's got, first and foremost, that document has results from yesterday's city council votes on 3 ordinances. So we'll go over those and some takeaways that I had as far as things that seemed to be important and emphasized that weren't necessarily, embedded in these ordinances, but some of the crosstalk that struck me as interesting. And then there's a new statewide health mandate. There's a survey that DHSS is doing. They want to know how all this stuff is impacting families. And also some guidance from the state on their intrastate travel, Mandate 12, as it relates to sport and personal use fishing. So that's a summary of what we'll kind of be going over today. And again, very glad to have you with us here. A reminder, too, once it's done, this show will be archived on our YouTube channel. So if there's something you want to listen to again, if you hear something that you think somebody else might be interested in hearing, you'll be able to point them to that link. So let's start with what matters most, and that's local content. In the new news release from the city, April 13th, 7 p.m., City of Cordova COVID-19 confirmed positive case count is still 0. As of April 13th, there have been 13 COVID-19 tests conducted in Cordova with 0 positive results and 1 test awaiting results. Local healthcare providers have the capability to test about 300 people in Cordova at this time. Your local healthcare provider will order testing, and the type of testing you receive will be based on the severity of your illness in accordance with the State of Alaska Department of Health and CDC guidelines. In other words, there aren't enough tests for people that want them to just ask for them. You have to meet certain minimum criteria because of the limited supply. Everybody is, all across the country, people are trying to work toward anybody that wants a test being able to get a test. But right now, it has to be ordered by a doctor. It says, please call your healthcare provider if you have any nausea, diarrhea, and or cold-like symptoms that have not resolved in 3 days. Additional testing supplies have been requested. While testing is an important tool in stopping the spread of coronavirus, your Cordova Medical Response Team would like to reiterate that social distancing is still the number one method for containing the spread of COVID-19. I would add to that staying at home is even better as much as possible. If you don't have to be out, just don't be. Take advantage of all of these options to order your stuff to be brought to you, and, quarantining is really super helpful. Social distancing is also super helpful, and masking, which the city has emphasized a number of times. Put that mask on, not only because it slows the spread, but it builds community confidence. The more people see other people wearing masks, the more of a reminder it provides that people care about this and are doing everything they possibly can to slow it down. So those are the stats. Now, as far as the city's report in their news release on yesterday's council meeting, Ordinance 1185 was passed at the special meeting, putting forth enforcement measures to support all Cordova orders associated with this emergency. According to the ordinance, failure to comply with an emergency mandate adopted under the City of Cordova's state of emergency is punishable by a fine of up to $500 per violation. Upon citation under this section, court appearance is mandatory, and this order goes into effect immediately. Violations of the city mandate may be reported to the Cordova Police Department. And this was, interestingly, divided as Cordova may be on some issues, this was largely unanimously supported. Not only was the ordinance passed 7-0, but all of the public testimony and virtually all the council testimony was in support of enforcement. You know, well, we obviously want everybody, we as a community want everybody to do these things because, you know, comply with these mandates because it slows the spread, minimizes the chance of exposure, and helps everybody to avoid getting it. While you want to just rely on altruism, human nature is human nature. And you're going to have, like we said before, you're going to have buttheads who are like, well, I don't care what the rules are. I don't have to do that. I don't feel sick. Rules don't apply to me. And they'll just blatantly defy it. So the phrase that kept coming up at the council meeting was adding some teeth to this. When you if you're not going to do it for the good of the community, do it because you don't want to pay $500 and you don't want to have to go to court. Not to mention the fact that many of the city and state mandates are parallel to each other. So if you're violating a city mandate, there's a very good chance you're also violating a state mandate. And violating the state mandates can cost you $25,000 and put you in jail for a year. So you've got exposure to state punishment as well as local punishment. And the city is, now, they didn't talk about that part. I'm adding that part just as an awareness because it's a fact. So people that just that know what the rules are and choose to violate them are looking at some pretty serious hurt. So I hope people will take that into consideration. We should point out, too, at this point, that while masking is strongly suggested, it's not required, at least not yet. So don't be trying to call the police and say, I saw so-and-so without a mask, because that's not good. But people blatantly, and two, something else that was said in the meeting about this is that the police are not going to use this as an excuse to start writing tickets and have this police state tattle on your neighbor situation going. That's not the intent. They said very specifically that what they're going to want to do is use the ordinance as a way to create points of contact and remind people, first and foremost, remind and educate. Because not everybody out there who is in violation of these things is being belligerent. Some people don't know or maybe don't understand. So law enforcement is going to educate first and use the fine and the punishment and that sort of stuff as a last resort for somebody who is just absolutely giving the finger to the rules. And they said that. I mean, that's not editorializing on my part. They talked about that in the council. That's the goal. So again, if you want to read what the city has to say about this, then you can look at this news release. You can get it from the City of Cordova website, cityofcordova.net. So that's 1185. And again, very strong support from the public and the council for, there were some police state concerns raised, and they were addressed. Not by the public, interestingly, either. It was a couple members of council said that they don't want this enforcement thing taken too far. But overall support for enforcement of the mandates was very strong. So that's clearly, based on the council meeting, is clearly what the community wants. Now, Ordinance 1186, that's the one that would have imposed a temporary hold on all travel by air into the city of Cordova. That failed to pass unanimously at yesterday's City Council special meeting. And the main reason that happened was a significant update to the small community travel order, which we talked about yesterday. Here's what the city news release has to say about it. The state of Alaska released an update to its Alaska Small Community Emergency Travel Order, Mandate 12 Attachment B, in which it states the order is applicable to Alaskan communities removed from the road system, population smaller than 3,000 as of the effective date of the order, and do not house a critical access hospital, sole community hospital, or acute care hospital. According to this update, because CCMC is considered to have a critical access hospital, Cordova is not eligible to impose stricter travel protocols than the state of Alaska has imposed. So long story short, the state has said that Cordova can't do what a number of locals have said they would like it to do. The provision of that petition that's been going around, it basically invalidates that. And the city's hands are tied. So if anybody is still interested in seeing Cordova or any of the towns like Cordova be able to further, isolate more than larger communities because of the influx of people in the summer, that's something that will have to be put to the state now. Continuing to ask the city to do something about that would really be, in essence, sort of a waste of your time and a waste of theirs. Any modification or allowances that could be made at this point would need to be made by the governor's office. So those that still feel very strongly about that and want to continue to pursue it should take it up to the administration. But the city can't do anything about that any more than the city has the ability to shut the fishery down, which is another thing that sometimes people ask or testify about at council meetings. Why doesn't the city close the fishery? Well, it can't. It doesn't have the authority. So those are things that need to be, if they're going to be protested, they need to be protested at the state level. Councilor Meyer, during the deliberations on that, made an interesting point that I thought was worth sharing, in that even though the travel hold can't be applied anymore to Cordova because of the change to the emergency order, it might be possible for Cordova to look at some of the provisions of that emergency order that would have applied if Cordova qualified. Because if you look at the order, this is this attachment B now to Mandate 12. It's the document that people were trying to use to justify kind of closing our borders a bit. There's a whole list of things that would have applied if Cordova qualified. But even though we don't qualify now for the whole package, there are possibly some elements of that order that could be individually looked at by the city, as long as, and this is what the city attorney said, as long as the restrictions or safety measures are not specific to travelers. So, for example, one of the things that happens in a community that does qualify under that emergency order, the state emergency order, one of the things that they would be able to do is, one of the things that would apply is mandatory masking for I forget the specifics. I don't have it in front of me, but there was a mandatory masking provision in there if a community qualified under the order. Now, even though Cordova doesn't qualify, the attorney said, as an example, that Cordova could look at, say, that masking provision and possibly decide to try making the wearing of masks in public mandatory. And if you go down the list of the different provisions in the emergency order, again, while they can't apply to the community, the whole list, you can't just dump the whole thing on the town, some of the things in there, some of the guidance in there might be things that the city could consider. And I think that, I don't remember 100%, but I think that they talked about the possibility of exploring that, or I at least saw people taking notes when the attorney mentioned that. Saw people jotting things down. Now, back to the next ordinance, Ordinance 1187. That was passed unanimously at yesterday's meeting. And what 1187 did is ratify revisions to temporary emergency rules and procedures in the city's Emergency Order 2020. This would move it from 2020-2 to a revision 2020-3. The changes to this order include new timelines and requirements for businesses submitting COVID-19 protective measures and policies, updates to social distancing protocols and the submission processes for mutual aid agreements, and new items requiring businesses to report state submissions to the city regarding cooperative measures between the city and the Native Village of Eyak, and then also concerning enforcement. A draft of the updated order is available to view on the city's website as part of the April 13th meeting packet. So go to the site, find the tab that is, I forget if it's city government or if it says mayor or council, but just navigate to that place where they keep all of the agendas and take a look at the April 13th meeting packet, and you can read that. And they did, there was one part that they struck that had to do, it was like a technical issue about authority for large purchases. And they did an amendment and took that part out. So I don't know if what's on the version of this updated city emergency order would be the one in the April 13th packet would still include that bullet point. I don't remember which rule it was. But they took that part out. Otherwise, the rest of it is intact. And there's some good information in there. So that brings you up to, by reading that revised emergency order, you'll get a sense of what the city expects in terms of the social distancing and enforcement and a number of other things. So that's what we're going to cover some more in this news release, but that's what the latest news release from the city had to say about yesterday's meeting. I wanted to add some other interesting parts of the conversation that struck me as interesting and things that people could possibly get behind. One of them was some discussion about these so-called hotspots, places in the town where people kind of, I don't know if you want to say have to go, but are more likely to go. Places like grocery stores, the post office, the airport, eventually the harbor. And there was public testimony and discussion among the council about what would be a good way to provide education and some oversight, not in the punitive sense, but in to have people sort of checking, I guess, in a helpful way as people go into these places. Like, for example, out at the airport, I don't know if you've seen, but there there's been at least one volunteer and maybe more going out to the airport and providing quarantining information to folks that are coming in. Because there's always the possibility that people are going to fly in and they're not going to know what the rules are for Cordova specifically. So these volunteers, masked, by the way, of course, and probably practicing social distancing at the same time, have some, I saw one picture of somebody, a big old sign on the van, and maybe some papers to pass out. I don't remember exactly. But the idea is that somebody was volunteering their time to be there to educate travelers coming into Cordova on what the rules are. And it was suggested, would there be a way to expand that idea to the harbor? Could there be, for example, somebody at the top of the ramps when people walk up with flyers or, put up big signs or something about remembering the quarantine rule and remembering social distancing and remembering that you are urged to wear a mask, or if masking should become mandatory, then, a big sign, don't forget masking is mandatory, whatever, that kind of stuff. Having people deployed to provide that education and that reminder at these hotspots. And some of the businesses have gone as far as to screen people and have restrictions on who can come in. Some of them are not letting anybody in at all. So, the individual businesses are taking this up on their own. But the idea of trying to cover these hotspots with education personnel, and again, helpers, not people with pitchforks, not, you're not there to yell at people and mask shame and some of this other, there's just some ridiculous behavior going on in some cases with regard to, people not helping but threatening, yelling at people who aren't wearing masks and drive-by threats and just, wow. I guess everybody has a place in the great circle of life, but yikes. Seems like we're better than that. But again, for people who want to help and educate and remind for the good of the community, I thought that was a very interesting discussion and worth passing on. Another thing that was interesting, and I have no idea whether it's possible, I have no idea whether the Coast Guard would be interested, but somebody mentioned, could the Coast Guard help with patrolling, perhaps, in the harbor or I don't know what their authority is or their willingness to be involved, but, they're certainly an important part of the community, and if they would have some ability, who knows, to assist. Again, there was testimony about the delaying fisheries, which I'm pretty sure council can't do. I could be wrong, but I'm almost positive that's a state or federal thing, probably state. Something that was brought up, I think, by a member of the public is, could we test everyone who comes to town, which is a great idea. Unfortunately, there aren't enough tests to do that, but that would be a good thing to lobby for. Now that pushing for a travel ban or travel hold is not a thing anymore, at least according to the council vote and according to the state documents, it was suggested that people take that initiative and enthusiasm that they had for doing that and now direct that energy toward trying to get more tests in Cordova so more testing can be done. I don't know if we could ever get to the point where you could just test everybody. I know they're working on that technology all over the country so that point-of-entry testing could possibly be a thing. I've seen in at least one of the processor plans that's what they're going to do with their workers, is test them before they even let them on maybe even a private plane. I thought one of them even said that they were going to test people, they were going to test the workers, and they had to test negative before they could even get on the plane to come to Cordova to do their 14-day quarantine. You'd have to read the any documents that are available on that. But anyway, testing everyone who comes to town, that came up. It's a good thing, I think, for people that want to be active in the prevention fight to push for. Again, you can't really push the city for it, but certainly make your voice heard at the state level. The city mentioned it's hoping to launch a resourceful website pretty soon to make things easier to find. They've been working on that, I know, real hard, and they hope to have it launched. I think the manager said they hope to have it launched in the next 3 or 4 days. It would have FAQ information. It would make, there'd be one button that says, "Are you a fisherman?" You click this button and all the assets for fishermen pop up, and ways for frequently asked questions, the answers to those questions to be displayed for everybody, and so on. There was concern mentioned by folks testifying about people quarantining on their boats, and what are they going to do about bathroom and, say, shower facilities, which I think is a good point. Somebody said they had proposed the ideas of having porta-johns out there to increase the capacity, and it would isolate people from each other rather than sort of a communal restroom. Of course, my concern would be, what about what gets left behind, even in a porta-john? But if they, if people are careful to, use when you're done to wipe everything down. I don't know if they'd have bleach water in these porta-johns or what they would do, but that is a concern, and a valid one, that arguably needs to be addressed. There was a fair amount of talk about more communication and more infrastructure regarding this whole thing, things like signs and, just more visible indicators to give people a better sense of what's going on in the community, to, warn people, inform people. Of course, it's always a very fluid situation. You could make a whole bunch of signs that say something, and then that could change. You know what I wish we had a bunch of that would help is those signs you see when there's road construction that have the blinking letters. I don't know if there'd be any way, if we have any of those in town, or if there'd be a way to import some, but having some of those would be pretty cool. Because then, for example, if the current guidance is that masks are strongly recommended, and you make a bunch of physical signs that say that, and then masks suddenly become mandatory, then you got to go change all those signs or something. Whereas those ones that are the ones that light up, that are programmable, those would be a lot easier to change. So I wonder if DOT has got any of those laying around that they're not using, or something that we could somehow get here. That'd be a way to maybe do that. Have one on Main Street, have one by the harbor. Place them in strategic sort of hotspot locations. Maybe have one at the airport. I don't know. But the council did recognize the need to be more visible, which is a very difficult thing to do when an idea comes up and then you have to check it against the state rules and the city rules, and in some cases the U.S. Constitution. They can't just fling guidance out there willy-nilly, because they could either be making a recommendation that's wrong for some reason and have to retract it, which just makes everything more confusing. So they're trying to be very, very careful with what they release, and they all recognize how frustrating that is, and I'm right there with them. We're an information delivery mechanism here, and I want to be able to get this information to you as soon as possible, too. And I am trying to communicate with the public information officers and even the mayor and members of the incident management team to do everything we can to get more information out in front of you so you know not only what's been decided as far as policy, but also can be kept up to speed on what's happening. Because that's a thing that a lot of people, including myself sometimes, are not fully cognizant of. How much progress is being made on these different things, like processor plans, like masking research, you name it, the various aspects of how the city responds to this. A lot of people involved in the city's response would like to be able to communicate more, but they just can't. They have to be very careful to avoid putting wrong information out. But they recognize how frustrating it is to the community. They're continuing to fine-tune their information flow. I'm continuing to maintain dialogue with them to speed things up as much as we can. That's not really right. Not speed things up, but make the release of information more robust, to update the community more regularly, not only on what's been done, but what's being done, what they're working on. That's a goal I have. I would like them to be telling you, I would like to help them find a way to tell you, if possible, more regularly, all the work that's being done behind the scenes. And even if they, have to say, we can't get into the details, say it was about processors. The city might have to say in an update, we can't get into the details, but we want to let everybody know that the incident management team is working with processors X, Y, and Z to do this and that. It's in the works, and we'll get the word out as soon as possible. But just to give everybody a continual sense of what's being done, and increase the volume of information that gets out, and then support that whenever possible with signage, public service announcements, which of course we're happy to do. Perhaps personnel, if they decide that they can and should deploy people to some of these potential hotspot areas for community transmission of the disease. Even if they haven't decided yet, just to report on the fact that they're working on it. I'm hoping to be able to assist in getting them to that point, and I know they're working on it. But the bottom line is they understand how frustrating it is to people when members of the community don't feel like information is flowing. There are very good reasons that information can't flow, but even so, at the same time, they're working on ways to try and increase the flow, to open up the tap a little bit more. And we're going to certainly do everything we can to support them on that. So those are my takeaways from things that I saw. Obviously, I'm just, an observer with longevity. I've been watching council meetings now for almost 30 years. So, but, I'm by no means any kind of an official voice. I just am sharing with you the things I thought were interesting. You may listen to the meeting and get completely different impressions, and that's fine. It means what it means to the listener. And by the way, a footnote, I would never, ever suggest that anybody, take action or interpret. That's a better way to put it. I would never suggest that anybody interpret what happened at a council meeting based on what you hear me say, or any commentator. I mean, you see this at the national level, and I think this is absolutely ridiculous, that people who listen to Rush Limbaugh or Rachel Maddow or Ben Shapiro or Chris Matthews or whoever, and they consider those people's interpretation of something as the law. Oh, well, that person said that's the way it is, therefore that's the way it is. That's nonsense. And I know some of those people try and position themselves that way, as they are the know-it-alls. Their interpretation is the true one, and that's what you need to know. That's absolute manure. Anybody who says that is just lying. The very best way to formulate an interpretation of what the president said, what the governor said, what the city council said, is to listen to the actual, in this case, city council meeting. Listen to it for yourself. It's available out there. We have it on our YouTube channel. I imagine the archived one is on the city's YouTube channel now. So if you think, geez, what JR said about what got discussed in the council meeting, I can't believe that's right. Maybe it's not. These are just my observations. If I'm not reading from one of the city documents. So really, the absolute best way to be informed is to go to the original material. Not clips of it, but the actual whole thing in context. Oh, I forgot something, too, that got mentioned at yesterday's meeting that is awesome. Somebody, one of the counselors said, re-emphasized the importance of reaching out to your friends. And I was like, yeah, because we've been talking about that big time on this program, as you know, if you've been listening to it. Let your friends know that there are things they need to know. And I mean, even more so now that trying to petition the city to implement those travel restrictions based on the small community emergency order, now that that's off the table, a number of the council members actually said that they hoped that now that that issue has been resolved and is basically a done deal, that they really hope all those people will rededicate themselves now to putting their energy into informing as many people as possible. Friends, family, acquaintances, even people that you don't like. Maybe you're a fisherman and you got some other fisherman that corks you regularly and I don't know the situation, but whether you like somebody or not doesn't mean that they can't be a carrier of the disease and spread it to others if they don't know how to behave in a way that doesn't spread it to others. So anybody that you can tell, anybody you can reach out to share this information about what Cordova wants and expects from anyone coming into the town from outside, whether it's for fishing or temporary job with the Village of Eac or the Science Center. I don't know who's doing temporary jobs and bring people in, but whoever, anybody that you know that's planning to come to Cordova anytime soon, let them know about the quarantine rules, that everyone is expected to do their 14 days. Everyone is strongly urged to wear masks. Everyone is expected to do social distancing. Every fisherman needs to be working under a plan, either one they do for themselves if they're an independent entity, or, the skipper or the processor or the tender, whatever. If you're working, you have to be under a plan. These are all, and all these other points. Very critical stuff to pass on. And the more people that are joining that chorus of sharing this information, the better our chances of minimal spread. So the council, and I would totally agree with this if I was sitting on the council, is imploring citizens to tell everybody that you possibly can about all this stuff. Give them links to the various state and local assets on the websites. Hey, friend or family member coming to Cordova, here's a document that you need to read from the city. Here's some from the state that you need to know before you come in. Here's some commercial fishing information posted at CDFU or UFA or AMC.org. That was one we learned about yesterday. AMC.org has got some fairly comprehensive documents, some sort of sample documents, procedure manuals, and crew education documents and things. Pass all that information on. If you really want to At this point, if you really want to protect the town, and that's not to say, there are going to be people who are going to want to run things up the chain and try to get the governor or the administration to still take more restrictive actions, and obviously that's fine. That's what the public process is for. But while you're doing that, if you're going to do that, if you could also make the time to educate people, man, that's where the real power lies in terms of having an impact. And also in terms of our own behaviors, if we have to be out and about. I think it was Counselor Gleason that said this. Pretend when you're out that everybody has it. Assume that whoever you see out in public is carrying it. Assume you're carrying it, because you can be with no symptoms. So just behave as if everybody has it, which of course does not mean yelling at people and shouting at them and and being a jerk. But I think most reasonable people understand what that means. When you see another human, if you're out having to do something essential, when you see another human, assume they have it, stay at least 6 feet away. If somebody comes closer than 6 feet to you, ask them, hey, let's do the 6 feet thing if you don't mind. If you are touching stuff in a public area, assume it's been touched by people who shed some virus. Again, not in a way to make people hateful to one another. That's not the point. But to make sure that you respond to people in a way that maximizes your sense of social distancing. Being in a mindset that anyone out there could have it, so let's just pretend everyone out there has it. Pretend that you have it, and that keeps us all in a good mindset for behaving in a good defensive way if we have to be out. Again, stay home absolutely as much as possible, but if you have to be out, assume that you and anyone you see is infected. Even though the vast majority are not, just assume it anyway, because it just makes it easier. You don't have to think about it. I think that's a great idea. Wow, that took forever, didn't it? Maybe we'll have to save this state stuff. None of the state stuff is really on fire. Well, let's just keep going here. Another interesting bit of tug-of-war came up as a result of people seeing that there was an incident in the harbor where somebody in full protective gear was wheeling somebody in a stretcher, which, of course, some people immediately assumed, oh, there it is, there's our first case, and went off on that tangent when they didn't really know. And, then the police had to come out and say, hey, we respond now to every case, whether somebody has a broken leg or whatever, we respond in full gear because that's part of our safety plan. But that whole thing created some push among community members for disclosure of people's medical information. And so the city put out a PSA regarding that and says, we understand the concern from some in the community regarding the recent EMS response in the harbor, but we must all respect patient privacy. Please take a moment to consider how you or your loved one would feel in a similar situation. We want to make sure it's clear to the community that first responders have begun to and will continue to wear additional personal protective equipment for calls in these uncertain times. The information that can be shared regarding medical and EMS cases is extremely limited due to the patient privacy provisions of HIPAA. I forget what that stands for, but it's the patient privacy thing. The city incident management team, city council, and all EMS and medical crews will be following all state and federally mandated protocols protecting patient privacy in these matters to the best of their ability. As we have said before, if any COVID-19 case is confirmed in Cordova, the public will be alerted as soon as possible. We thank you for your understanding. So that pretty much speaks for itself. They are legally barred from disclosing people's personal information, but they want everybody to understand that they're going to be responding in that personal protective equipment to anything. They don't just put it on for a potential COVID case. They put it on for every response. Okay, how are we doing on time? I think we can do these other things. Quickly, a new COVID-19 health mandate from the governor's administration. The state of Alaska is prepared to implement a temporary quarantine and isolation program utilizing non-congregate shelter solutions, including hotels, college and university dormitories, and properly modified non-traditional structures to house three specific populations. Number one, first responders and healthcare workers who need to quarantine safely without exposing their families. Number two, homeless families with at least one member who's tested positive for COVID-19 who live in congregate shelters and will require isolation. And number three, homeless individuals who require quarantine or isolation. You might have heard about this. This is being done in places around the country where hotels and dormitories who don't have any people in them because of the isolation requirements and the shutdown of the schools and people not traveling and so forth. Some of these are making their facilities available for quarantining, much like apartments. You know, if you've got a family with a sick member, these homeless families particularly, they can all stay together and do their 14 days and isolate in a hotel room or a dorm room or something, which, of course, would be totally sterilized before it was handed over to somebody else or put back into regular circulation. So that was a new state mandate that came out. And I don't know if any local facilities are doing that, and you can download that from the state site. It's Health Mandate 014, Health Mandate 14. Something else from the state that they're interested in. They've got a survey exploring how the pandemic is impacting Alaska families that they'd like to have folks participate in. The Alaska Department of Health and Social Services announced a launch of a series of surveys of Alaska families to find out how the pandemic is impacting their lives. Obviously, it's affecting families with children and teens in multiple ways with no school. And the programs in the Division of Public Health are seeking the public's input in understanding the challenges Alaskans are facing. The responses will be used to improve programs serving Alaska. And the way to participate in the survey, the easy way, is to text AK Family to 907-269-0344. Again, you would text AK Family to 907-269-0344 to participate in a short survey about the impact of COVID-19 on you and your family. And if you're in a position where you weren't able to jot that down, hearing it from me, or remember it, you can see this press release on the state website. If you go to coronavirus.alaska.gov and look under their press release section, this is the one. DHSS survey explores how COVID-19 pandemic is impacting Alaska families. You'll see the text that I shared with you, and you can what to text and where to text is on there, along with a link if you want to just poke the link. It's a big old long one. I'm not going to give that to you on the radio, but again, text AK Family to 907-269-0344. And finally, another news release that came out yesterday. Sport and personal use fishing restrictions related to Health Mandate 12. It says, the Alaska Department of Fish and Game is informing the public that Health Mandate 12, intrastate travel, that's going between Alaska cities, states that all in-state travel between communities, whether resident, worker, or visitor, is prohibited unless travel is to support critical infrastructure or critical personal needs. Sport and personal use fishing have not been identified as supporting critical infrastructure or a critical personal need. The purpose of this mandate is to control the movement of individuals to communities within Alaska in order to prevent, slow, and otherwise disrupt the spread of the virus. Although travel between communities is prohibited under the health mandate, the public may still travel to fishing locations. When traveling to participate in sport or personal use fisheries that occur outside of their communities of residence, the public must follow these guidelines. Number 1, try to find the resource you intend to pursue as close to your home residence as possible. Number 2, find out local mandates in communities through which you plan to travel before you leave, and you must abide by them. Number 3, totally provision your trip from your community of origin. Don't plan on buying food, drinks, or even fuel, if possible, after you begin your trip and until you return home. Number 4, practice social distancing while sport or personal use fishing with anyone not considered part of your immediate household, including while traveling from your community to your fishing location. And number 5, wear face coverings as suggested in Health Alert 10, issued April 3rd. Adherence to these stipulations will allow Alaskans the opportunity to fish and put food on their tables while taking measures to protect public health and allow time to build needed health infrastructure. Please adhere to the stipulations to ensure these opportunities can continue. Be safe and considerate of others. So they're not suggesting that if you live in Cordova and want to go somewhere that you like to fish for sport or personal use, that that's bad. They're mainly talking about people, say, who might try to come from Anchorage to fish in Cordova. They still don't want that happening, but they're clarifying that it's not a problem for people in a town to go to areas near that town, as long as you do all of these different things that are recommended. And if you want to read this, this is a news release that came out on the 13th. Again, you could find it at coronavirus.alaska.gov. And it's sport and personal use fishing restrictions related to Health Mandate 12. Okay, that was a lot, and we're done. Thank you for listening. We were brought to you by Cordova Wireless Communications. Can't do this without them. It's very much appreciated. This show will go online as soon as Robbie can get it posted. YouTube.com/Cordova TV. We'll do something for the daily briefing. If we can talk to a city official, we will. Otherwise, we'll cover something else. I'll just do it. And we'll get the rest of the programming that was missed during the 10 a.m. hour in for you, so you don't miss out on that. Everybody, treat each other well, please. Remember, wearing a mask not only slows the spread, but also sends a signal that you care about the rest of the town. And most importantly, tell everybody that's not here what's expected of them when they are here. You really want to make a difference? In the opinion of this broadcaster, that's the very best way. Tell everybody that you possibly can what's going on to make sure they know before they get here. Sound like a plan? I think so. Have a great day. Thanks for listening to Town Meeting.